right, good morning. We're running in this morning to the hospital to do an exercise stress test for kids. And some people might be like, do kids actually get exercise stress tests? Do they need stress tests? So I figured I'll drop a little note about that this morning as to why a kid might actually need a stress test. So my name is Dr. Olawale Olabiyi, Dr. Wale Olabiyi for those who don't know me. We do exercise stress tests for children who have different symptoms, different conditions, chest pain, palpitations, chest pain with exercise, syncope, passing out, or sports clearances sometimes depending on the symptoms, and sometimes things like if someone has like a pectus excavatum, a dip in the middle of their chest, and they need surgical clearance. So we do exercise stress tests for different conditions. We check them out. We have the child run on a treadmill or use a bicycle, but generally speaking it's a treadmill we use, and hook them up like you see in those Gatorade commercials with the mask and the tubes and all the wires, and have them run, and we make a bunch of measurements and check and see how effective their ability to do work is, and how well their heart's performing and how well their heart's doing. So this is a test that we can do in kids normally about 8 years old and up, sometimes a little younger in some situations, but 8 years old and up, if they can follow instructions. And for me, I have to do them early in the morning because I got to run to clinic and see patients. So here we go. Let's get the day started. Let's go. Okay, we are now in the hospital about to go in for the stress test. It's gonna be a good one. Like I said, I work in a pediatric specialty, pediatric cardiology, Children's Hospital, which is why you have the items behind me, the hanging shapes. All right, so I'll probably post a video or a reel or something about the indications for exercise stress tests and why your child might need one. And if you have any questions or any other things you guys want to learn about, let me know. But this stress test that we're doing today is particularly for tachycardia induced by exercise. So patients was running and the heart rate speeds up suddenly above what they expect. So we're trying to see if this patient has something called supraventricular tachycardia, and then from there we can treat it and go forward. All right, you guys have a good day. Stay blessed.